Hi, welcome to another one of our Dr. Foot videos. This video is actually about knee pain, well, to be more specific, patellofemoral joint pain, which is pain in and around the kneecap. Now I see quite a few patients with knee pain, around 15 to 20%. They don't generally come to me with knee pain, but when I do ask them, do you have any pain in your knees? Quite a few of them say yes. Now, there are many different causes for knee pain, and I could talk about each individual cause and condition. It would be a very long video. However, I'm going to talk specifically about patellofemoral joint pain. This is my knee model. I haven't taken this from a patient of mine, so don't worry. Patellofemoral joint pain is in and around the kneecap, and it's a diffuse kind of pain. So patients say it hurts here, and it's quite a wide area. They don't tend to point to a specific location. If they did, I'd be concerned about a different kind of condition. The pain tends to be worse when walking down the stairs. Adolescent girls are more vulnerable to getting this kind of pain. As they're getting older, certain muscles need a bit more strength and the patella can be maltracked. It's usually painful around the inside of the knee, about 80% of cases, on the medial bone, on the medial border of the knee rather than bone. As I said, there's quite a few different causes and conditions for knee pain. I'm going to talk about the anatomy because I think it's important that people know about the anatomy, because knowledge is power. And when doctors or physios or other health professionals like podiatrists talk about structures, I think it's important that you know about these structures. So let's start with the bones. So we've got the large thigh bone, which is the femur. We've got the shin bone, which is called the tibia, and then there's a small slender bone on the outside, which is called the fibula. The patella sits inside a patellar ligament or tendon, depends on who you're speaking to. This is formed by the four big muscles of the thigh, so they will come together and they form this structure here, this tendon. If a patient points at a specific location, it tends to be just here, just below the kneecap, says it hurts here, then it could be tendonitis within this tendon itself. We've got two structures on the outside of the knee called the MCL, which is a medial collateral ligament, and the LCL, which is called the lateral collateral ligament. There's quite a few other structures on the front of the knee that are not in this model, but I'm going to talk about them a little bit. So we've got these bursas, and bursas are like small fluid sacs which aid the movement of joints. Now we've got one at the top, which can get inflamed. You can get bursitis there. The more common ones to get inflamed is one that's right on top of the kneecap. So it's called the prepatellar bursa. Sometimes you can feel it. You can feel that it's swollen. There's two below the knee cap with the actual patella itself. There's one sits superficial and one that sits deep. A lot of people that are working in manual labor, who are on their knees quite a lot, can get this damaged. Let me talk about a few other structures. Now, apart from on the outside of the knee, there's a ITB, which is called the iliotibial band. Sometimes that can be aggravated. What you can't see here is a pes anserine. I'm sure I'm saying that wrong. I always pronounce it wrong. There are three muscles that go into here. There's also a bursa. That can also get inflamed and get painful. Let's have a look at the back of the knee. Now, there's a couple of important structures. We've got the ACL, which is the anterior cruciate ligament, the PCL, which is the posterior cruciate ligament, and there's also another ligament that runs from the meniscus, which I'm going to talk about in a minute, right next to the ACL. I know I'm getting really geeky, but I think it's really important that you learn about the anatomy of the knee. This blue area here, these are the meniscus. Now these act like shock absorbers. Now, after talking about all of this, the reason why I spoke about the anatomy, because there are so many different structures and I haven't even spoken about all of them here. Diagnosis is key, as I keep saying in all my videos. It's important to go to a podiatrist or a physio or a doctor, somebody who is capable of like assessing a knee and that knows the structures around the knee and can be able to accurately diagnose what type of knee pain you have. So I find a lot of patients who will assume they have osteoarthritis in the knee when they don't. Now, the risk factors for getting patellofemoral joint pain, it can be patella alignment, can get maltracked. In my experience, it's often muscle strength, or rather a lack of muscle strength. There's been for years and years we blamed one muscle, which was the VMO, which was the vastus medius oblique. However, research has proven that it's not just one muscle that tends to be weak. It's quite a few muscles, and we focus more on the hips. However, as always, I try and treat the entire kinetic chain, and I will find, if I find a weakness or a restriction, often it's the hip flexors, I will address all of that. It can also be abnormal biomechanics of your foot, can lead to this kind of diffuse pain. Also, interestingly, it's the way that you sit and the way that you walk. Patients who have too much thoracic flexion, which is your chest, can also be a contributing factor. It's never the only factor, but it can be a contributing factor. Now, what do we do? Well, I will always give a tailored exercise program, which I will progress as we move forward. I may or may not tape around the knee just to alleviate some of the stresses around the knee. I tend to give orthotics, but not custom orthotics for this kind of condition. I tend to recommend anti-inflammatories. It depends on the patient themselves. And if they're a runner, I may talk about how they run, and we may explore if we can change their running style. There's quite a few other things that we can do. If we have time, then we can do acupuncture, ultrasound, laser. However, as with all the conditions that I talk about, I always like to address the underlying cause. So if I can find the underlying cause, if I can find why the patella is painful, why that area is being stressed, then I will address the underlying cause. Patients can get better quite quickly. Now, it all depends on the diagnosis. As I've touched upon, there are so many other conditions that can occur within the knee joint, and there's so many other risk factors that I haven't spoken about. As always, diagnosis is key. Knee pain isn't the end of the world. I have a lot of patients who get quite upset. They think that they're going to end up in a wheelchair, and people tend to think the worst. So they start looking on the internet and they assume that the worst is going to happen. It's not always the case. There's many different causes of knee pain. As I keep on repeating, the important thing is to get diagnosed and visit a podiatrist who can do MSK assessments, or a physiotherapist, because some really good physios out there who can do a MSK assessment and have a look at your knee, have a look how you're walking, have a look at your function in different movements, so different dynamic movements that you will be doing, and to assess what structures need to be strengthened, what structures need more flexibility, and how we can give you a bit more stability in your shoes. Hope this was helpful. Take care.